So the U.S. saw another sharp rise in deaths across the country, and that's in part because of how victims are being counted now. Nearly 31,000 American lives have been lost, and that includes more than 4,000 New Yorkers who were never tested but did show symptoms. So for more on this, we want to bring in Dr. Shoshana Ungerleider to sort of explain why we might see this spike in numbers. You've been waiting for a while. We had a little bit of a delay in starting, so I really appreciate your patience. So hospitals and laboratories, doctors, are still reporting test shortages and backlogs. What type of problems do we face if we do not ramp up testing quickly enough?
Well, Anne-Marie, the reason why the U.S., frankly, has had such a high number of confirmed COVID-19 cases compared to the rest of the world is that we acted very late. We did not have testing capability early on. We still don't have widespread testing available. It's much better than it was, but it's not nearly adequate. And listen, we know this virus is highly contagious. It's invisible and it moves very quickly. So we need to understand more about how it spreads, the prevalence of disease, why it impacts some people but not others, where it's occurring most, and we need more testing to be able to do this. The reason we're here today, having to continue to shelter in place, is that we couldn't test asymptomatic people early on, and we still don't quite have the capability to ramp up testing as we need to. And this is really critical for us to be able to move forward and reopen society.
Doctor, we mentioned this earlier. President Trump is expected to issue some new guidelines on social distancing in a bid to get the U.S. economy back up and running. The question I guess a lot of people will have is, one, are Americans confident enough to go with the president's recommendations and put their lives at risk by opening up the economy prematurely? Because a lot of people have cited what has happened in, for example, Singapore, where they did not see a huge increase or a huge number of deaths related to the coronavirus initially. But subsequent to that period, we've started to see a small surge ticking up in Singapore. So the question, I guess, that I'm sort of driving at here is, Governor Cuomo of New York has said that we are starting to flatten the curve here in New York State because of the measures we've put into place. Is there a risk by sending Americans back to work that could be all wiped away?
Vlad, I think it's important to note that there's no 100% risk-free way of easing up on the current physical distancing restrictions. It's just not possible. Public health and government officials are modeling several potential scenarios to move forward. And as Dr. Fauci has mentioned several times and others, it won't be like a light switch that all of a sudden gets turned on one day and that everybody goes back to life as it was. It'll be a slow and a very gradual ease back in, and likely be very regional based on the prevalence of disease, meaning that certain areas will have their restrictions eased in a really deliberate manner, with safeguards in place for testing for the virus, testing for antibodies, which, as you know, is immunity to the virus. And then, of course, an infrastructure, which is so critical to track all of this, to isolate and trace cases if new outbreaks, crop up. And then really, honestly, the bottom line is any solution needs to balance the economic objectives with the public health objectives of our country. And so I think that the governors to be bringing up these issues are right in doing so. This is critical when we think about this as a widespread public health issue.
So you just touched on sort of the two types of testing that people are talking about. Antibody testing to determine whether you have already been exposed to the virus and are clear and presumably have built up some sort of immunity, and diagnostic testing. Do you have it right now? A lot of experts say expanding diagnostic testing is sort of key here, being able to be tested quickly, get your results quickly. And I know, around the country, many people still can't be tested unless they're showing symptoms. And now we're learning more about the virus. We know there's a huge possibility that, you're not showing symptoms and you still have the virus and you're still perhaps spreading it. Can you walk us through the importance of expanded diagnostic testing when it comes to curbing this virus?
Yeah, Anne Marie, for social distancing measures to be safely lifted, we'll need to be running millions of tests a week. As you pointed out earlier, we've only run a total of 3.3 million tests to date over months. So this is something that we absolutely have to have available across the country for asymptomatic people, symptomatic people, anyone that needs a test. And this will largely depend on having a really resilient supply chain of testing supplies. Because if we run out of swabs or caps for the test, you can't run them safely and accurately. And so that's also really critical as that supply chain issue. I think once the virus caseload has significantly decreased, we'll absolutely need to do more testing and then isolation if needed to make sure that the virus isn't spreading to the point where we'll need to do this level of social distancing again. So in order to do the number of tests that we need, we will absolutely require a large scale push to not only ramp up facilities that can test, but also to resolve some of these supply chain shortages that we know currently exist.
You know, Doctor, it's such an interesting point that you raise. Senator John Kennedy of Louisiana, in an interview yesterday, said something that was, I think, telling. In arguing as to why he believes the economy should reopen, the senator said this: when we end the shutdown, the virus is going to spread faster. That is just a fact, and the American people understand that, close quote. That's a quote from Senator Kennedy. Essentially, if I understand him correctly, Doctor, what he's saying is that if we reopen the economy and we don't have this contained, the virus will continue to spread. And unlike the flu, in which there are vaccines, in this particular case, COVID-19, you have asymptomatic people that are running around that could infect people that are the most vulnerable, and even some who are not. Obviously, the stories here in New York and across the country there have been countless stories of young, healthy people who have succumbed to the coronavirus. So I wonder, is he accurate in saying that this virus could actually spread at a much quicker rate if we reopen the economy before we have all the testing in place, before we have the virus accurately contained, and even before we have a vaccine?
Yeah, Vlad, I think that's an interesting point. We do know that asymptomatic people can absolutely spread the virus. We know that it's impacting people of all ages and all underlying medical conditions. And so it's very, very important that when we think about reopening society, as everybody wants, it needs to be a concerted, deliberate effort on the part of our state officials, our federal officials in concert, and that we need to do it in a way that makes sense based on evidence and data. Most public health officials agree, including Dr. Fauci, that this cannot be just turning on a light switch and allowing people to go back to work and return to life as it once was. I think we're going to see a very, very different path forward here, something that everybody's going to need to be very flexible around. We're not quite there yet. In fact, I think we're many months away from that period of time. So the one thing we can all do now to stay safe is to continue to stay home.
That's great advice. Dr. Shoshana Ungerleider, thank you so much for spending some time with us. Sorry we had to make you wait, but I think it was a really fascinating discussion for our viewers, so we really appreciate it.
Thank you.